Coming up, we'll be on location at Standard Dental in Potomac, Maryland, discussing full facial makeovers and how they can give you the look you've always desired with one of this region's top facial surgeons, Dr. Ali Eliassi, and one of this area's top dentists, Dr. Malika Shattergoli. Dr. Eliassi is board certified in oral and maxillofacial surgery and is a member of the prestigious American Academy of Cosmetic Surgery and is widely recognized as one of this area's top doctors. Dr. Shattergoli has an extensive focus and experience in cosmetic dentistry and certifications in both cosmetic and implant dentistry and is widely recognized as one of this region's top aesthetic dentists. Welcome, Dr. Shattergoli. It's a pleasure having you on our program as well.
Thank you for having me, Rocco.
I wanted to begin by asking you, Doctor, if you can please tell us what a smile makeover is and what it entails, because it's become a very popular cosmetic or aesthetic dental procedure, and I just wanted you to educate us about it.
Sure. So what a smile makeover is basically you'll sit down with a patient who's had issues regarding their teeth, they're unhappy with a certain thing, and we address it and we see if it's something we can fix conservatively or we have to take a more invasive approach to fix it. So it all begins with a consult and figuring out what the patient's desires are. We'll basically examine their smile line, their midline, and see what little things we can kind of fix here and there to just brighten up everything.
So you basically customize your smile makeover treatment based on each particular patient's situation, his or her needs. No two patients are alike, right? That are looking for a makeover. And then what happens next? Like, as far as like, what are some of the treatments involved within the smile makeover?
Sure. So once they basically come in and they'll give us an idea of what they're looking for, we can start off conservatively, whether it's just in-office bleaching and they like the shape of their teeth and they just want to brighten things up. That's a very easy approach to start off with small. Or we can do things like Invisalign if they want to fix some crowding or they have a little spacing here, but they like the shape of their natural teeth. So we utilize their natural teeth and work with that. If it's something more compromised and there's cavities involved or advanced discoloration, missing teeth, then we kind of give them some options as far as veneers or Emax crowns. We can kind of give them different treatments to fix those and kind of brighten up their smile that way. So it really pretty much depends on what the patient is working with and what their end result is that they desire.
Yes, indeed. And what type of results are you seeing from the smile makeovers in your patients?
So with the new technology, we see a really, really natural look. Before, you would see things that look really artificial and you can tell that the patient had some work done. What patients aim for now is they really want something that's going to brighten up their smile, but people aren't going to really notice that they had all this work done. So definitely, I would say a natural aesthetic look so that patients will come in and say, this is a smile I've always wanted, and now when I walk around, people can't pinpoint what it is I got done. They'll think that I got my hair fixed or I got some new skincare. So that really is something that we like to aim for, is we want something natural but brightens up and makes the patient feel good.
Yes, absolutely, because as I mentioned to Dr. Eliassi, there's nothing worse than getting an aesthetic treatment and looking like you had an aesthetic treatment.
Exactly. You don't want people to know that you got that treatment. You just want to feel like something is brightened up and looks nice and
yet natural at the same time.
Natural is the key.
Yes. Now, what is this about a smile in a day treatment that I'm hearing that's got a lot of buzz out there? Can you tell us about that?
Sure. So a lot of patients have dental anxiety and they've let their teeth go and they've unfortunately so many things have been compromised where you can't just go in and fix one or two things and their problems are solved. So what a smile in a day is for those more advanced cases, we work directly with the oral surgeon like Dr. Eliassi. We'll team up and in one day he will place the implants and then the restorative team, myself and our lab, will step in and will attach and restore those teeth on the implants that he placed. So basically the patient walks out with a full set of teeth. They don't have to wear a temporary, they don't have to be embarrassed that they have to be missing teeth for a while or take off work. You basically restore that whole smile in one day in a matter of a couple of hours.
That's very impressive. I mean, for the busy professionals, for the folks out there that don't have the time to come back multiple times, right? Because normally when we think of a smile enhancement treatment, we're thinking, oh, other than bleaching, obviously, or whitening, we think we have to come back multiple times, but that's not the case with Smile in a Day.
No, and the comfort, because you have the oral surgeon right there sedating you, so you're pretty much asleep for the surgical aspect. So it's really, it takes that fear away, and then it gives them immediate results, immediate confidence. So then all those worries that they've had for several years, it can just be gone in a matter of a couple of hours. You get that smile you've always wanted, and you have that team taking care of you in one day.
Well, that's as good as it gets right there. And on that note, Dr. Shattergoli, I'd like to thank you for joining us, educating us a bit about some of these hot treatments and who can benefit from them, and being a guest on our program. It was our pleasure having you on.
Thank you, Rocco. Pleasure was mine.
Thank you. Welcome, Dr. Ilyasi. It's a pleasure having you back on again.
Thank you for having me back.
It's your second time, in fact, on the Top Doctors interviews. Today we're at your beautiful Potomac, Maryland location. We have a lot to talk about. We also are going to be joined by Dr. Shattergoli a bit later in the program, not to mention a couple of patients as well. But I wanted to begin, if I may, Doctor, by having you please tell us what a full facial makeover is. I mean, it's become so popular and it's very hot right now, and I wanted to have you on to tell us about it.
So what defines beauty? That's the big question, is when you're looking at somebody from the top to the bottom, what is your definition of beauty? And they say the beauty is in the eye of the beholder, and certainly when you look at the beautiful paintings like the Mona Lisa or some of the other Da Vinci paintings, you try to see what is considered beautiful out of that. And a lot of it has to do with what is beauty in the eye of the patient. And we try to bring that beauty that they have envisioned in their head out to real life. And all the aging changes that we can actually reverse, or more so, do preventive sort of work, where we can do some preventive work where we can prevent them from having those sort of aging, where they're stuck with having to do more surgery down the line to reverse things. So a full facial makeover, you look from the hair to all the way to the neckline, it can entail a lot of things, but the main thing is what will make the patient happy, and what is considered beauty in their eyes, and trying to bring that out to reality.
Yes. No, great points, Doctor. And I wanted to ask you, what factors do you consider, for example, when evaluating a patient for a full facial makeover? In other words, what are you looking at that you feel in a person that can benefit from something like this?
Sure. So the main thing to look at is symmetry. A lot of people come to you, the human anatomy it's mostly about symmetry. We look at asymmetries from whether it's the top brow all the way to the chin. If there's any deviations from symmetry, we can change that to bring back more curvature, more appeal, to make it so that ultimately the patient's happy. And you can really take a look at anybody's face and criticize it a whole bunch, especially when you're looking at things from a doctor's or a facial plastic surgeon or a maxillofacial surgeon's point of view. You can really pinpoint things and criticize things, but sometimes less is more. And so every person has to be evaluated separately. But the main thing I would say is symmetry. When you look at a flower, or you look at a painting, or you look at anything in nature, a lot of it follows very symmetric laws of nature.
Yes, indeed. So you really look at what you just said to see how to keep it symmetrical, to bring out the best in each particular person in their appearance. And it's really from the hair right to the neckline, as you said. It's a total facial makeover we're talking about.
Absolutely. We have people, great people to work with that would go from all the way from the hair to the myself, who does the facial surgical rejuvenation, and of course Dr. Shattergoli, who you're going to meet in just a second here, who does beautiful cosmetic facial aesthetic art. Yes. You have to call it art because yes. We're in the business of art, and I'm a big art fan. You have to be when you're doing facial makeovers, facial cosmetic surgery, dental cosmetics. You have to be in the business of art to be able to look at how can I help here to, with the knowledge I know and that you've empowered me to make things prettier so that you, who is the patient on the other side, can have that that beauty in your mind, because ultimately it is the beauty in the eye of the beholder.
That's right. You're basically an artist, just like Dr. Shattergoli and any other doctor that focuses as well on cosmetic, aesthetic treatments, because you really have to line everything up. You're trying to enhance the look that the person has, right, to bring out the best in each individual's appearance.
Absolutely. And a lot of times you can even highlight the more subtle things in a face and do minimal invasive surgical procedures, and really sometimes it can even mask the other things and just be brilliant for the patient.
Yes. Now, who's a good candidate for the full facial makeover?
Anyone is a good candidate. Anyone. Because even as we mentioned earlier, that it's a case by case. And so if a person comes, of course, with a lot of medical issues and so on, we have to modify our treatment. But if the person has very subtle issues, or if they're a lot younger, we see a lot of younger patients coming. And at first I was a little skeptical about doing, for example, Botox in younger patients. But the reality is what we're seeing is it's prevention of wrinkles later down the road. So would you rather prevent some wrinkles from forming, or would you have to deal with it at an older age or a later age and have to do more surgery to reverse that? So anyone is a good candidate. And we tailor that sort of treatment based on what their needs are. And as I said, sometimes less is more. And so with the patient, you have to really see what can we do minimally to get the best brilliance out of their face.
Yes, because whenever someone has a cosmetic procedure, as we all know, nobody wants to look like they were, quote, done, in other words. You want to look as natural as possible, and that's what I've been so impressed with your work, Dr. Shattergoli's work, the before and after pictures, a couple of patients we're going to interview a bit later, but really some great work you all are performing here and doing on your patients.
So as a surgeon or a general dentist, I appreciate that. And doing good work is reflective of us as the provider to enhance the patient in such ways that they have to go out and show their brilliance, their smile, and be fantastic in our world, and not have to get additional treatments, but be happy and spread the word, spread the love.
What types of problems can this treatment also help people with? Are there problems that it can correct as well?
Absolutely. Absolutely. Good question.
Because we're talking obviously from the cosmetic side thus far, but I know there's also various problems, as we mentioned, that it can also really aid a lot of folks with.
I had the luxury of an excellent 10-year military history with the Army. That was the luxury of it, was great training, great people, great experience. The downside was that I got to see a lot of ugly things. Ugly meaning the casualties of war, the casualties of aggression. Unfortunately, gunshot wounds and gunshots and motor vehicle accidents, these are part of our reality. As far as how we can help not just the average person, but the people who have sustained trauma to their face, who need scar revision, who need teeth reconstructed. From the top to the bottom, we can give them that life that they once had that was taken away from them.
Yes, yes. So you have that unique perspective because of your 10-year military background, as you said, where you saw those unfortunately horrific accidents and issues that people were dealing with. So I would take it from that, you know, from something of that extreme, that basically helping people with other problems is, you know, a lot lighter for you, I would think, compared to some of the work you're doing back in the military with some of the war victims.
Right. So, like I said, it was a great experience. It was a fantastic time in my life. But unfortunately, I got to see a lot of very challenging cases.
Sure.
Which is good in a way that it makes the cases that I'm encounter on a daily basis not as challenging. So it's great that we can offer these sort of enhancement and beauty procedures for patients that want it on an elective basis, but more so, it's fantastic that we can offer it to patients who need it. For example, a patient who's been in a motor vehicle accident or sustained trauma to the face, whether they've lost bone structure or soft tissue structure or teeth, we can restore from top to bottom.
That's certainly interesting and good to know. And I wanted to ask you, doctor, briefly, if you could tell us what the process is that a patient typically experiences when they contact you, as well as some additional treatments, services that you all offer here at Standard Dental.
Sure. So a lot of times the trauma patient, we get contacted from the hospital directly.
Okay.
On an elective basis, the patient comes to the office and we do a full evaluation, history and physical, find out their needs, find out what their expectations are, and basically tailor their expectations, needs. We tailor their treatment based on what they want. Get back to a happy medium, but also enhancing that beauty based on what is, again, in their eyes, beautiful. Because if they can shine and be brilliant and love their smile, love their face, that's the whole idea. We want them to walk out the door loving their face. And we can do that from a facial cosmetic standpoint, from a dental standpoint, working with Dr. Shattergoli, who's top with aesthetic dentistry. And we can do it either minimally invasive, non-surgical, which we have a great variety of treatments, whether it's vitamin C, collagen, Obagi products, all the way to full face.
We're now going to meet some patients of both Dr. Ilyassi and Dr. Shattergoli. Welcome, Layla. It's a pleasure having you on our program.
Thank you. I'm happy to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin by asking you, how did you hear about Dr. Ilyassi and Dr. Shattergoli? What brought you here?
Actually, my older brother, he recommended that I come and see Dr. Malika. I needed braces, and all the price quotes I got in the area were ridiculous. I'm talking like anywhere from $8,000 to $9,000 and 2-year programs, and it just didn't feel right because it was a minor procedure.
Yeah.
And then I got lucky, and when I met Dr. Malika, I felt like she was sincere. She actually told me that I only needed them for 4 to 5 months, and she said that I only needed to pay $2,000.
And what were some of the quotes you were getting from other doctors and dentists?
$8,000, and one was $9,000.
That's a huge
I know.
difference.
I'm telling you, I've had bad luck with dentists my entire life.
Until you came here.
Thank God I found them. I'm not going anywhere.
Well, I'm happy to hear that. And as far as Dr. Ilyassi, what have you had done through him?
You know, I've always been scared of needles, which is funny because I told you earlier I had Botox done with him. I don't feel the pain. Both doctors are actually very gentle with needles. And now I don't have that fear anymore. I had Botox on my face, a facial chemical peel, and then the vitamin C enhancers.
Oh.
Changed my whole look. And I wasn't one to have an upkeep with any kind of lotions. I didn't take care of my face. Mm-hmm. And now I don't have to. It was very easy, the whole process, the upkeep, everything.
And that's the full facial makeover you had.
Mm-hmm.
Well, you look great. Your skin looks great. It does.
It's funny. Every time, I come out of the doctor's office, people are like, what skincare line do you use? What are you using? What are you using? And I have a bunch of their business cards, and I just hand them out.
regarding Dr. Shattergoli, can you tell us a little bit more about any additional dental treatments you may have had from her as
Yeah,
well?
so I was confused whether I was going to do braces or Invisalign. But after she kind of really walked me through the process and we evaluated what I really needed, and I told her that I was on a budget. She said, let's do Invisalign. This is what you need. I was so happy. She put me on a payment plan, so she made me feel comfortable with the whole situation. It wasn't like I was jumping into something. And the best part about it was, like, after I had gotten my initial, I was in a lot of pain just for just the transition, I guess. I had her cell phone number. I could text her and tell her and talk, she talked me through it. And to have that kind of connection with a doctor is fantastic.
Absolutely.
I got lucky.
Oh. And I understand you've been a patient of the practice for a few years now?
I've been here 3 years. So I've actually done teeth cleaning, regular checkups, whitening, crowns,
All that.
everything. I mean,
That's great.
she's my go-to. And I've had a long line of just miserable dental experiences.
Yes.
But I'm finally found somewhere where I'm happy.
You don't have to worry about those type of experiences anymore.
No, thank God.
And before we let you go, Layla, is there anything else you'd like to share with our viewers?
Well, if you hate going to the doctor and you hate the dentist, coming here is just life-changing. I love coming here. They make you feel so comfortable that you're not scared to come to the doctor. It's just, they really know what they're talking about. Their bedside manner is fantastic. They really give you the information that you need, and they send you home happy.
We'd like to thank you, Layla, for joining us, being a guest on our program. Thank you again.
Anything for my doctors.
Welcome, Maggie. Thank you for joining us as well.
Thanks for having me.
Now, I understand you also had a full facial makeover here.
Yes.
Can you please tell us about it? What was that like?
It was actually very exciting. It was something new to try. I had a little bit of concerns, but I wanted still the natural look, and I actually achieved it very well. The doctor did an amazing job.
Oh, you look great.
Thank
you really
you.
do, just like Layla before you, both of you.
Oh, thank you very much.
Now, how long did it take in your case?
In my case, it's been a process because I had some facial peels,
Okay.
which I'm really glad that the doctor carries a specific brand, which is Obagi, which is a really great brand, and he's been out there for so many years. So with them, you have to have a little bit of resting time after you do anything else. So it's been a whole 6 months of process of getting peels, Botox, and fillers. But I have achieved the natural look that I wanted, and I'm really happy with it.
No, the results obviously look great.
Thank you.
Now, for the folks out there watching, what would you tell them about your experience with everyone here at the practice? What's
Well-
that been like for you?
Well, it has been a great experience. Both doctors have been a blessing. They are very experienced, and also, they are very personal, and they talk to you. They explain everything step by step, and that really puts your heart at ease.
Yes, that's very important, isn't it?
Yes.
Because we have that tendency to have that nervousness going to a doctor or a dentist, but it's so much easier and better when we feel relaxed going there.
Yes, and that's something that they're great at. They will, answer all your questions and be very specific about the things that you need to do and not to do while in this process. So it's been a great experience, and both of the doctors have been amazing to me.
Well, on that note, we'd like to thank you, Maggie, for joining us and sharing some of your experiences and being a guest on our program.
Well, thank you very much.
Now, what kind of results are your patients experiencing, and do patients generally experience from some of these very popular non-invasive and some of the invasive treatments you've told us about today?
Sure. It all depends on what the patient's getting. Anything, for example, like Botox and fillers, they typically last 4 months to 6 months. Okay. If it's a full facelift, you're talking about 10, 15 years. Yes. But, more so, it depends on, one, what the patient is getting and what kind of outcome they're trying to achieve. Yes. I'm trying to push more so for preventive sort of work. If we can push a lot of the skin products, the Botox, the fillers, the rejuvenation in some of the patients before the wrinkles occur, then we can prevent them from having to get major surgery down the line.
That's a great point. Take that preventative route through the non-invasive treatments that you mentioned, ideally, to keep them, their skin and face looking years younger, as opposed to, the other route, which would be the surgery, which obviously you offer multiple types of surgical treatments, which you've told us about. But I like your approach.
Right, because I mean, let's face it, the Botox, the fillers, the chemical peels, a little eyelid removal from the top of the skin from the eyelid, these things are in and out procedures. A little mini facelift, these are in and out procedures that the patient can, almost get during their lunch hour, between on break at work, coming and going. If we can do some of the more rejuvenating things that are less time consuming, less recovery time for the patient, get them back on their feet and back to work as quick as possible, and yet prevent them from having to do more major invasive things down the line. I think that's a greater benefit to the patient.
Absolutely. Now, we're literally out of time, Doctor, but I wanted to ask you, before I let you go, you and your practices here, you have 3 locations for all of you out there watching, between Greenbelt, here in Potomac. Obviously, you have a location in the Vienna, Tysons area as well in Virginia, to keep it very convenient for folks to come to you and utilize all your experience and services and treatments you offer. And you have a great reputation. You're one of this region's top facial surgeons, obviously as one of this region's top oral surgeons as well. I just wanted to ask you what you feel helps separate you, Dr. Eliassi, and your practices apart from many of the others.
Question is a great question. I think it's quality versus quantity. A lot of times we are forced in society to go to these places that make you come in and go out like an assembly line. Right. But just like everyone's thumbprint is different, same respect, everyone's treatment's different, everyone's needs are different. So by giving them that quality of care, individualized attention, I think that makes us superior to most of these assembly line sort of practice treatment areas or regions.
Yes, you really offer a customized approach, which you've stressed over and over, not only today, but your patients love you. I mean, the patients we interviewed today, very happy with the results as well, and they're just a very small sampling of the many that you and your staff and Dr. Shattergoli as well help people with each and every day around the DMV region.
Glad to help.
Well, on that note, we'd like to thank you again, Dr. Eliassi, for joining us, and we'd love to have you back on a 3rd time, in fact, at your Vienna location.
Appreciate it.
Okay?
Thank you.
Thank you.